Friends, welcome back to my YouTube channel. This is ManpreetRN Talks. So today we are going to discuss about the most important topic in the maternity, that is labor, true labor and false labor. So what is labor? Labor, that is the of series that happen in mother's womb to result the delivery of fetus and placenta. Labor refer to the sequential physiological changes that occur during childbirth that result in the delivery of fetus and placenta. So that series of events include uterine contraction, cervical effacement and dilatation, descent of the fetus, expulsion of the fetus, and expulsion of placenta and its membrane. So there is two types of labor, true labor and false labor. So what is true labor? True labor means actual onset of childbirth with progressive changes in the cervix. So the contraction, they are at the regular pattern and they are increasing in frequency, duration and intensity and becomes more stronger over the time and it falls in the back in the start from the abdomen, it goes backward to the back and then it go downward to the hips. So that is progressive in the nature. So, and it continually occurring without resting or positional change. So as a mother, when he is having labor to labor, so mother is experiencing pain and it is not resolved by resting or taking position resting. Then the cervical changes. So cervical changes include cervix start to dilate and effacement is starting. So in that true labor, so cervix is starting from 0 centimeter to 10 centimeter and the effacement is occurring starting from 0% to 100%. So with true labor pains, effacement and dilatation is occurs and the pain that is increasing in the nature and it pain does not subsides by the rest. And the other signs that include blood issue and rupture of membranes may be present. So next is the false labor that we call Braxton Hicks. That is the irregular labor pain the mother experienced during their pregnancy. So false labor means practice contractions, body preparing for the labor. So in the contraction, they are irregular, do not increase in intensity or frequency, and they are usually mild. In that usually decrease with or stop with walking or resting or taking hydration. So, and the cervical changes occur. There is no dilatation and no effacement in the cervix. And the pain that is mild and it usually felt in the lower abdomen that does not go to backward and the hip groin area. So that is the major difference between the true false labor and false labor. So true labor that usually regular, false labor is irregular. True labors it's goes from the from abdomen to move backward and then go downward in the hips or groin area, but false labor that only occur in the abdomen and it usually mild in nature and in that no bloody show, mucus plug is not seen here and the membranes that are intact. So that's all about true labor and false labor. That is very important from NCLEX point. So always remember it. So study today, pass NCLEX tomorrow. Join Manpreet RN Talks for more updates and tips and tricks to pass your NCLEX in first attempt. Thank you.